Okay. Can you hear me now? I think I fixed it. B, you might be late, but no one has been able to figure this out yet. Amazing. B, you were in fact on time because guess what? The cats did not knock something loose. It's actually not the cat's fault. Um, what happened was that our power went out for like 4 or 5 hours today. Not related to us. It had nothing to do with us. Like a couple thousand people had their power just randomly go out. I had just gotten back from the gym and I was in the shower and all the lights went out. And we do like sometimes have a wiring problem in that bathroom. So I was like, oh, it might just be here. And then I noticed it was very quiet. And I was like, oh, the washing machine is not going anymore. The dryer is not going. And then the backup server started beeping before I got out of the shower. So, hello, B. I think that you are the one who caused it to work again. I think that's entirely due to you. Um, Thank you all for bearing with me. That's a great way to wake me up. And yes, my tech support is in fact on a plane. But my tech support was texting me, which is good. And also, this has reminded me. So my whole setup, even though it just looks like this is a bunch of little things, my whole live streaming setup pretty much is on that cart, like all of the mixers and the ATEM. And I don't dust it very often because it kind of just works and it just stays. And touching that audio mixer reminded me that when I do my dusting of the house, I should also dust my live streaming equipment. So thank you all. Cheryl says you are up. Is this directed at me or is it directed at someone else? Because if its audio levels are up, let me know because I might have screwed something up when I was adjusting things. If I'm too loud, let me know. If I'm blowing out the audio, I think I didn't touch anything related to the actual audio levels. I had to set the date and the year and the month and the day before it would let me connect it, and it was very annoying because it was very fiddly. All right. Well, today what we are going to be talking about is what Machka's going to be talking about is her quest to race up and down the stairs. What I'm going to be talking about is rural healthcare. And this is obviously too big of a topic for a single live stream. But in particular, the bits that I'm interested in are how things are changing in the world of healthcare, rural healthcare specifically, from two primary things that have happened this year. DOGE, Department of Governmental Efficiency, is trying to do this streamlined federal payment system, and where they're essentially trying to roll up all of these federal programs that give money to Medicaid providers. So you might be familiar with this if you know people that are living with HIV. The Ryan White program is one of the programs that provides payment for HIV medications. That's an example of one specific federal program where the payments are their own thing, but then they kind of come in addition to Medicaid. And in some cases, Medicare, although that is complex and applies to only a couple conditions, one of which can be AIDS. So DOGE also was responsible for just halting the payments to a ton of entities that receive federal funding, either federal loans, grants, administrative support, of which rural hospitals disproportionately rely on federal funding. In the US, a lot of hospitals exist as not-for-profit institutions. So they might pay taxes, they might pay provider taxes, they might pay some version of taxes. Obviously, they'll pay payroll taxes because they're often the largest employer in many areas. But increasingly, there are for-profit hospitals in urban areas. Rural areas are almost always community benefit or nonprofit healthcare services. And because of this, they tend to get more federal funding. The math does not usually math out for rural hospitals. Rural hospitals have been on the edge for about the past 15, 20 years. They've been closing at a rapid rate. I think there's been 100 rural hospital closures in the United States in the last 15 years, and one has opened. I think one has opened. Let me check that stat because it is pretty okay. So this is the most recent stat as of April of 2025. 167 rural hospitals have closed since 2010. And yes, 10 have opened in the entire United States in that time. So, and that is significantly worse than hospital closures in urban and suburban areas. Why does rural healthcare rely on federal funding so much more? Well, they usually don't have very high patient populations. So, it's unlikely that patients are going to fee for service, as it's called in healthcare, is not enough to pay the bills. They usually have a smaller base of donors for endowments. They tend to have smaller donor bases altogether. And they tend to have smaller endowments when they do have endowments in order to like make up for X and Y. One of the other reasons that rural healthcare has been facing a lot of challenges is because it can be extremely hard to recruit providers out to rural healthcare. And I think we've all heard about, and I talked about last week when I was talking about the student loan caps and how that's going to affect like providers, healthcare, doctor providers mostly, access, like they're going to be uninterested in going to rural healthcare, especially like GP and professions that don't pay as much for MDs because they won't be able to pay back their student loans if they've got a bunch of inflexible private student loans because they've hit their cap on federal loans. So there's been a like increasing rural physician shortage over the years. Some of that is like the complexity of like, we've gotten a lot better at treating chronic conditions. That requires more other types of professionals and not just like the doctor that comes out and like gives you a couple pills and then sends you to the bigger city if you need something. More and more we need providers for dialysis care. We need, as people live longer and longer lives, while in kidney failure, we need, people that can manage complex chronic conditions like autoimmune illnesses or, type 2 diabetes, which is in fact more prominent in rural areas as a percentage of the population. One of the things that can significantly influence access to healthcare in rural areas is that they just cannot attract the professionals, the paraprofessionals that they need to make the healthcare system work. In Baker City, Oregon, a town of less than 10,000 people in Eastern Oregon, 2 years ago, their hospital system closed its OBGYN, and there's no access to care for pregnant people in Baker City. Baker City is in the mountains. It's quite isolated. It has mountain passes on the one highway that can go in or out. And the nearest alternative facility to get specific care for having a kid is 40 miles away in La Grande. And that mountain pass closes really regularly for either wildfires or snowstorms. The other direction is even longer. It's about 85 to 100 miles to go to Boise, Idaho from there via Ontario, Oregon. I don't know how much people know about their geography of Eastern Oregon, but and there were a couple reasons why this closed. So this is a hospital that's been serving the community for like 130 years. It Baker City was like on the Oregon Trail, so it is been occupied by settlers for a very long time. And the like abundance of healthcare there is part of what led to early prosperity for the city. Baker City has been doing better than a lot of other rural towns as far as it still maintains some level of industry. Ranching is a major industry there, as is forestry, but the forestry is like kind of dying out these days. Some of which is due to regulations, and then some of which is just due to changes in the industry. So, rural healthcare, rural healthcare in particular, has been impacted by provider shortages. It is about to get worse for the reasons I mentioned last week in the student loan episode, because they just can't pay enough to attract the providers that they need. So in Baker City, one of the reasons given by the hospital is that they just didn't have enough nurses. One of the problems that they had is when there weren't enough births happening, the nurses didn't want to work in other parts of the hospital. They're like, this is what I've specialized in. And they were filling in with temporary nurses so they didn't overstaff relative to the number of people that were giving birth. And one of the temporary nurses got their license revoked by the state. And essentially Baker City was like, the Baker City Hospital was just like, cool, we don't know where to get another nurse from. It's not like there's a rapidly growing population out in Baker City. There isn't a lot of available housing for new people moving there. It's just one of the challenges that a lot of these smaller rural healthcare facilities have to deal with. Okay, so where do federal funds come in? Well, because they are often short on providers, because they usually don't have the patient numbers to kind of make up for things, often they will get funding from the federal government. So there's two type of rural facilities that I'm going to focus on, which are rural hospitals, which are exactly what you picture when you think of a hospital. Although when you're thinking of rural hospitals, you need to understand that like a typical like urban hospital might have like 500 or 1,000 beds. In a rural hospital, they might have 50 to 100 beds. They might even have 20 beds, depending on how small it is. When we talk about rural, there's actually two distinctions as well. There's rural, and then there is frontier, or quote unquote highly rural. And that means that you have less than 2 people per square mile. So it's really quite rural. Highly rural is the technical definition. In Oregon, we call them frontier typically. And that is a federal definition that comes from the funding for federally qualified health centers. So all of the federally qualified health centers are they are essentially the first stop for patients that wouldn't have access to a private practice for anything short of emergency care. So you would go to the hospital for an ER, and then an FQHC is a federally qualified rural health center. And FQHCs are, they'll care for people with chronic conditions. They'll do outpatient surgeries. They'll do outpatient care. But they don't necessarily have overnight beds. Sometimes there are FQHCs that do behavioral health, which is also a really big crisis in both urban and rural areas. And there's even like fewer providers in rural areas than there are in urban areas. But FQHCs and rural health centers were all supposed to get a bunch of funds in April, and then they just got frozen by the government. This led to like a crash on the portal, because as things were kind of happening with DOGE and Elon Musk in the government, all of the people that had already been promised money. Like, this money is like available to them, but they do quarterly draws usually. Sometimes they'll do monthly depending on the type of grant that they have, but they'll do monthly draws against an amount that's always promised to them. It's usually on a reimbursement basis. And the portal crashed for a period of like 36 hours because it was sort of like one of the hospital directors described it to me. It was sort of like a run on the bank. All of these hospital administrators were getting very worried about what was happening with Elon Musk and people not getting access to funds, and that they all tried to log in at the same time and request their already promised funds. So, we've already had all of that chaos. Most of those hospitals have since received their funds. There's been a number of lawsuits and injunctions and back and forth between state AGs and the Trump administration and DOGE. I mean, there's just been like a whole mess of things that have been happening. But the National Rural Health Association, which is a lobbying and policy group that works particularly on rural healthcare, one of the big things that they said is that like most rural hospitals are already operating on negative margins. And so even a 2-week to 1 month delay in like promised funds could put them under. And when rural hospitals close, quite often, it is due to financial reasons. When I mentioned that OBGYN services are not available now in Baker City, that is a trend that is nationwide in the United States. About 20% of America's rural hospitals have completely dropped OBGYN services. And this was already like tenuous, right? It's already a hard thing to continue to provide in a rural hospital for a bunch of reasons. One of those just being like, you can't control the demand for the services, right? There's a lot more shift in other kind of specialties, or if you have a lot of just ER doctors that are just handling like emergent cases. But you need specialists for this. And if there aren't enough people having babies where you are, then it makes it harder to maintain. They also tend to not, they tend to be very costly to run. Let's just say that. So, when it comes to looking at what this sort of edge of the federal funding does, of the hospitals that are not for profit, even the ones that are not for profit, actually, there's been more and more conglomeration in this space. So, as we've talked about with pharmacies before, like there's 3 pharmacies that represent like 90% of, in the insurance word, they call them lives, but we'll call them patients, right? 90% of people in the US that are insured are getting their pharmacy services from 3 different pharmacy benefit managers, which are vertically integrated with pharmacies. So you'll probably recognize them if you use pharmacy benefits in the US. There are CVS Caremark. Wait, sorry, my computer is acting weird. Give me a second. Okay. So the big 3 are CVS Caremark, Express Scripts, and OptumRx. So those are pharmacy benefit managers, which are supposed to be the middlemen between the insurers and the pharmacists. However, they're all vertically integrated now with their own pharmacies, and they are all vertically integrated with a health insurance plan. So CVS Caremark is vertically integrated with Aetna, which is the largest insurer in the country. Express Scripts is a subsidy of Cigna, which is also a major insurer that provides like quite a few kind of versions of it. I think CVS Caremark, you can understand, is CVS is the pharmacy underneath that. And then the final one, Optum RX, is which health, I'm trying to remember which health insurance company owns. Oh, everyone's favorite healthcare company, United Healthcare, is who owns Optum RX. So they don't tend to have a retail pharmacy side for Optum RX, but Optum RX is a pharmacy benefit manager that also is the pharmacy, which they're not supposed to do, but they are doing. And now CVS Caremark is also manufacturing drugs, which I like 100% should not be legal, but whatever. I've done a story on that before. Okay, so rural pharmacies have been having the same problems that we've been dealing with a consolidation. Rural hospitals have been getting either bought up by private equity groups, which is happening in like across the healthcare industry, where private equity is coming in and buying up practices. They're buying up, dialysis centers. They're buying up providers. Private equity's got their hands in all parts of these pies. If it is not a for-profit healthcare company, but it is a not-for-profit healthcare company, there are a couple major consortiums that are essentially buying these rural hospitals. And they start looking towards their bottom line, which is part of the healthcare management business in the United States, unfortunately. But that bottom line looks really unattractive for certain types of services. Certain types of services do not bill well and are costly to run. And obstetrics, I hate this word, obstetrics, this is why I say OBGYN all the time. Obstetrics is one of those services that is very expensive to provide, has a shortage of qualified providers for it, and often doesn't pencil out. Now, let's talk about why they're getting double slammed. So they're like heavily reliant on federal funds. Now, the Big Beautiful Bill. The Big Beautiful Bill was a massive, but it was also like packed full of things that relate to how we pay for healthcare. The big one that made a lot of headlines was the Medicaid cuts. So essentially, there is like $58 billion of Medicaid cuts over the next 10 years in the One Big Beautiful Bill Act, which some people call the Senate Budget Reconciliation. This means that a lot of hospitals, rural hospitals in particular, are going to close. So they are changing the way that Medicaid reimbursement is using this like unified payment plan. And there's different kind of estimates out there. The best estimates that I've seen is that this is going to represent like a 20-ish% cut in how much rural hospitals are going to actually see out of Medicaid funding. Why is this important? Well, Medicaid funding is much more prevalent in rural areas than it is in, by percentage, than it is in urban areas. So, and it's even more prevalent among children, right? Because usually children and sometimes pregnant people are likely to qualify for Medicaid, even in states that didn't take up the Medicaid expansion. Even the Medicaid cuts that have come in the Big Beautiful Bill, they mostly will not affect children that are already qualifying for Medicaid, and they won't affect pregnant people a lot of the time. We'll come back to that. That doesn't mean that there won't be effects on people. Like people are going to die from these Medicaid cuts in the Big Beautiful Bill, but I don't know, in the words of one legislator, well, we're all going to die. So, it feels dramatic to say that people are going to die from this, but in healthcare, that inevitably ends up happening anytime you're trying to do these like large sweeping policy changes, is that will be the consequence of many actions, right? You're either saving lives or losing them when it comes to healthcare cuts. I don't know if that sounds very cavalier of me to put it that way, but like that's the way the facts line up. So Medicaid is a really, really vital source of healthcare coverage, and combined with the Children's Health Insurance Program, which is a specific type of health insurance accessible to people that might make too much for Medicaid for children. And it Children's Health Insurance Program is like Hillary Clinton's baby from the 90s. When Hillary Clinton was first lady, she worked very hard to try to like fix healthcare in the United States, and she did not succeed. But the sweetening pot that she got was CHIP, Children's Health Insurance Program. Um, there is a much larger share of both children and adults that in rural communities that are covered by Medicare, and an even higher percentage that are covered by both Medicare and Medicaid. And the people that are covered by both Medicare and Medicaid generally are older and poorer Americans. Not 100% of the time, because there are certain circumstances in which someone qualifies for Medicare, even if they have not hit quote unquote Medicare age yet. And that can happen if you have certain diseases that have essentially carve outs. A great example of this is through the Ryan White program. Like, you can qualify for it if you are at a certain stage of HIV has progressed into AIDS. You usually can qualify for dual Medicaid, Medicare enrollees. This often happens to people at the very, very end of their life when they have drained all of their assets in assisted living facilities, and then Medicare will kick in, which is like, we could talk about why that's like maybe not the best policy decision, but it is a very complex policy thing that not many countries have done an excellent job of figuring out how to do this as we live longer and longer. And also people that might have like black lung disease, they have another specific carve out. This is some of the stuff that DOGE kind of wanted to combine with the quote unquote unified payment systems. It's not really, I mean, how this is going to be done, I think in the short term is going to represent cuts to hospitals that rely on Medicaid coverage. Okay, so nearly half of all rural hospitals have negative margins. I need you to like hold that in your head. So they're already running in the red. And the number that I most recently got from the National Rural Healthcare Association, so this was May 2025, was that 400 rural hospitals across the US were like at imminent risk of closure if they didn't get the promised federal funds within like weeks. Like, they were weeks away from running out. And like I mentioned, obviously we've seen a lot of specific types of practices and access closed in rural areas. Now, if Medicaid disenrolls people, as is intended and likely from this Big Beautiful Bill Act, then what is going to happen is, in addition to reducing the amount of like Medicaid dollars, just pure dollars that they're going to get, if the way the payments are processed is as it is written in the bill, they're going to be getting less of each of those dollars, because they're going to have to use a specific type of payment system that is much more costly for small hospitals if they're not part of like a larger network, right? Because you get aggregate scale advantages with your billing for Medicaid if you're part of a larger system, but more rural hospitals are independent compared to urban hospitals, which are usually part of a system, and just usually have more economies of scale. Okay, so I mean, we are just slated to have really, it's about 25% of, I think it's 24 or 25% of people that live in rural areas are covered by Medicaid. It's much lower in urban areas. The breakdown by state is a little different because some states have Medicaid expansion, some don't. But it's around 20% in urban areas. So it's a higher percentage overall. But then where it really starts to break away, like I mentioned, is births. So of people having kids in rural areas, it's 40 to 50% of births are covered by Medicaid. And so this is like it is very likely that there's like a double compounding effect. So they're going to have fewer people that have access to this, and then they're going to be getting less money for each of those people. So like you would like the way that the Medicaid reimbursement kind of reductions are happening is a little legally complicated. I wonder how much do people want to know why states are getting less money from each Medicaid dollar, because it's a little complicated and I might not explain it as well as I hope. Fuzzbubble says, it's almost like we should fund hospitals to help people, not to make money. Well, what's interesting is like, I would almost make the argument that rural hospitals far and away are more likely to fall in that camp. Like, for like rural hospitals, they do have to balance the budget, but one of the reasons they're constantly financially on the edge is they are more likely to be not for profit, and they are, you know, more likely to just treat every patient and then kind of figure it out in the water. And they're, you know, they can't really like profit maximize in the same way. All right, y'all, I've been talking a lot, and it was pointed out to me that I didn't show you the donut, so I am going to show you the donut now. We were distracted by all of the hubbub with the lack of audio because our power went out. So, we've had this donut before. I gave it a 4 out of 5, but I thought I would do it again, but I am going to have to heat it up, I think, because it's a savory-ish donut. So, it is a cheesy potato fritter, and it's exactly what it looks like. It's huge, and it's got like, it's very greasy. It's got vegan cheese in it. It's got potatoes in it. And then it's got like a garlic oil wash and then little bits of garlic on it. I mean, it's good looking. I gave it a 4 out of 5 last time. We'll see if that holds this time. But I do think I will need to heat it up. Should I eat the donut now? We've been going for a while. And I'm just off on a rant. I have more things. I could talk about rural healthcare forever, and how screwed everybody is going to be. Oh, David joined and says, was in Sophia last week and just joined. What did I miss? Well, you mainly missed me trying to figure out my audio situation. Last time you said potato is a fruit and it gave me a migraine. Well, I think I said potato is not a vegetable. I don't know. I feel like I've learned that everything is a vegetable. Or nothing is a vegetable. I do remember this, though. Potato is a stem, actually? What? No. It's a tuber, though. It is a stem. Oh my god. It is a fruit. Isn't it a fruit just because you can use it to grow more potatoes? Because if you think about it, a fruit is a fruiting body. And it does grow eyes. So, I'm an economist. Don't listen to me about this. But if you think about it, a potato is a stem, and you can plant it to make more potatoes, which you can't do with a vegetable. Right? You can't plant a carrot, which I think is a vegetable, and I think it's actually a root, not a stem. Is it a carrot? Is a carrot a stem? Okay, y'all, I'm going to heat this up while you discuss, because I think we might be time for a donut. Yeah, see, a carrot is a root, and a carrot is a vegetable, but maybe a potato is actually a fruit. So grateful and happy to have power again. I really was not sure we were going to have this live stream because of the power. And I mean, I guess we didn't have the first 10 minutes of live stream. We were trying to figure it out. I think fruit are the food for the seeds, though, not the fruiting part itself. Vegetable is culinary term, not a biological one. Nothing is a vegetable, correct? Tubers aren't pollinated. Oh, I see the point there. Okay, I just heated this up in the microwave, and I did it on a wooden plate, and I was like, I don't know if I put wood in the microwave. Can I put wood in the microwave? I mean, I know you can't put metal in the microwave, but I was like, wood feels like you shouldn't put it in the microwave, but it seems fine, so I don't use the microwave very often, but I felt like we didn't have time for the toaster. Y'all, this is Talking Dough and Eating Donuts, so we're gonna... Yeah. All right, so here is today's cheesy potato fritter, which is apparently... It is apparently a fruit fritter because we have just determined that potato is a fruit. So it's so big. I think this is the same feedback I gave last time, but this is very greasy. Like, almost too greasy to be as enjoyable as I want it to be. The garlic is perfect. Potatoes make seed pods you can't eat. What? Potato berries are small, green, and resemble unripe tomatoes. These fruits grow from the stems of the potato plant. I'm also reading the AI overview, which always makes me nervous because it could be just hallucinating things about potatoes. I really need to turn it off. I feel like sometimes it's helpful, but sometimes it just really hallucinates things. How is a potato a fruit? A potato is a fruit because it's a fruiting body. And it's not a root. The part you eat is not a root. It's a stem. Y'all, should I go look up the tariff category for potatoes and we can determine if it's a fruit or a vegetable from that? In the harmonized tariff schedule, potatoes are classified under Chapter 7, edible vegetables and certain roots and tubers. So it isn't saying it's a vegetable, it's saying it's a tuber. But frozen potatoes are under 0710.10, and fresh or chilled potatoes are on 0701. But I love the idea that potato chips are prepared potatoes, which does make sense, but it feels wrong. Prepared or preserved potatoes, potato chips granules fall under 2005.20. So the harmonized tariff schedule of the United States says that they are a vegetable, root, or tuber. It's so cheesy. The Orange Guys team is not who writes the tariff codes right now. I've been looking through old Instagram posts during this stream and came across a picture of a potato donut from Portland, Maine. That's hilarious. You can really see the potatoes in here. Should I do the overhead view? You can really see that. Like, they are just in there. There's so many things in here. They are excellently cheesy, I would say. I don't think this is getting a change to its status. It continues to be a 4 out of 5. David, if you went outside and got ice cream, I bet you would be less upset about the song. I'm just going to say that. Sophie, is the breeding project to produce viable seeds? What is the end goal there? Is it that they'd be easier to transport and store than potatoes themselves? Oh, that's fair. You have post-traumatic softy disorder from Mr. Softy boxing you in your car for 30 minutes while they played the song over and over. It is kind of like the ice cream song in the tone that those ice cream trucks play it is very like the stuff of nightmares. All right, I'm not going to update the donut log because I'm continuing to give it a 4 out of 5. I will show you the old donut log. We still have one more week before new flavors, but I think next week I'll try to get one of the sandwiches that I haven't had before. But yes. So I had it like a month and a half ago. Shouldn't you add a second date to the log? I don't know. Should I add it in the date? I feel like for each donut, if the rating doesn't change, I don't think I need to update the log. I guess it kind of depends on if we are also considering it a log of all of the times I eat any donut. Sophie says, I heard about it on gardening YouTube, so I'm going to go with love of the game. I love that idea. All right, y'all. What else do we want to know about rural healthcare? Will you stop attacking my feet? I have a cat attacking my feet. I can't show you the cat, but... Reaffirmed rating. I like the idea of, like, the rating has more data points on it now. Okay, y'all. What else do you want to know about the state of rural healthcare right now? So, the big thing to understand is that rural hospitals have already been facing like a massive decline over the past 15, 20 years. However, in rural areas, employer and sponsored insurance is much lower than the rates in urban areas. And Medicaid is often what makes up the difference. So there's higher rates of people using Medicaid. And of the Medicaid enrollees, a lot of them are children. And so there is like there's a couple kind of ranges of analysis, but a lot of the initial analysis is from think tanks and policy organizations about how many rural hospitals are likely to close because of the Medicaid changes. So the cuts to Medicaid, in addition to cuts to funding, one of the other things that they did was they limited provider taxes. So it used to be that states could implement their own provider taxes on hospitals, sometimes like large other healthcare facilities. It depends on the state. And they would tax that, take it as a state, and they would use that towards their match because states have to provide a match to the federal government for Medicaid. In some states, that can be as high as like a 6% tax on providers. And you would think that providers would be like, oh my God, amazing, because they capped it at 3.5% in the big, beautiful bill. And you think providers would be like, amazing, less taxes is great. But the downside of this is most providers are quite against it because they recoup that money back in Medicaid patients and Medicaid payments. So when providers get taxed by the state, that money just is used as a state match to get federal Medicaid dollars. Generally, states provide between 2 and 5% towards their Medicaid programs. It does vary a little bit depending on how you do the calculations. And then all of those patients that need healthcare needs, they come to hospitals, to clinics, and that eventually those hospitals and everything go on and bill the Medicaid, and they get that money back. So overwhelmingly, providers are against these cuts to Medicaid. Like providers in really rural areas, for-profit providers in rural areas are calling this like cataclysmic, like a storm as far as access, as far as their ability to sustain themselves. A lot of the people that are going to be most affected are areas that heavily supported the incoming administration who just made these cuts. But a lot of these people aren't going to see these cuts for another like 2 years, right? So one of so there's overall, like there's less money going into Medicaid because of this, because the states, blah, blah, blah. But there's also going to be fewer enrollees. So in Oregon, which has quite high Medicaid coverage because we have this like continuous coverage program from 0 to 5 years, and we have pretty generous expansions. We also have sort of like a Medicaid plus for people that like make too much for Medicaid, but they can get like a more subsidized kind of version of the Oregon Health Plan, which is our Medicaid plan here in Oregon. We are very much a blue state. Like not all the state is blue, but the policies are blue because most of the population and most of the representation is in much more liberal parts of the state. So, but we do still have I think we have 40 frontier hospitals in this state because we are huge, we are spread out, and a lot of those FQHCs and everything are providing services to a population of 600 people over, the same amount of square miles. You've really got you've got an interestingly split state. So, refocusing here, sorry. I was going to refocus, but then I literally forgot what I was talking about. I went off on a tangent about Oregon. Oh, okay. So in Oregon, the estimates are about 200,000 people are going to end up being disenrolled and dropped from the Medicaid rolls because of these new work requirements that have been implemented. And generally, when we talk about the Medicaid work requirements, the problem isn't that we have a rampant amount of able-bodied adults that are refusing to work and just living off Medicaid, which, by the way, you can't live just off Medicaid. That is alone not enough to live off of. It doesn't pay for your housing, it doesn't pay for your food. But this idea that you've got these lazy people that don't want to work is the narrative behind this. And the idea is oh, well, if you're taking care of children under 13 or you are working, you just need to submit some paperwork and you'll be able to stay on OHP or Medicaid, whatever it is called in your state. Realistically, there's been 2 states that have kind of implemented these Medicaid work requirements, and they turn out to be a hot mess. The bureaucracy ends up costing money. Like, overall, it does not save any money for the Medicaid administration in the states, and people lose their healthcare coverage, not because they don't qualify, but because the government is very bad at paperwork and bureaucracy. I mean, like, how many times have we had have anyone experienced the issues of like having to submit verification paperwork? Like, if you've ever had unemployment insurance and you've had to like go through the whole rigmarole and the phone tree, imagine a less efficient system than that. And the administrative burden is very expensive. It's very costly, and it doesn't actually improve care for anyone. And what ends up happening is the people that like most need Medicaid, like working, working poor adults who don't have kids, who need it because of, they need access to chronic health conditions. They can't work full time, which is why they are like their income is under the Medicaid line. What ends up happening is the paperwork doesn't get through in time. They lose their healthcare coverage. And in many cases, they end up losing access to medication or doctors they need. And then that makes them unable to work. And so we've seen it in the states that have implemented these Medicaid work requirements, is that you see nothing move on the needle as far as employment. Like, it does not change the amount of people that are employed. And in fact, in a couple cases, we have seen where we've actually depressed employment, partially because people can't hold on to a job if they can't keep on to the meds that they need in order to be, stable, safe, and healthy in order to go work. And so it has like really significant consequences. And this is... Did I hear that plane? It took off almost straight up vertical. No. Fuzzbubbles asked for a FQHC, Sardi. I mentioned them earlier, but then I should define my terms. Federally Qualified Health Center, which are clinics and healthcare facilities, but they are not hospitals. And they serve the highest, like, more of their patients usually are represented by either Medicaid or Medicare. Not always. You usually don't have to be on Medicaid or Medicare to go to an FQHC, but often their patients are. I've talked about this before when it has come to rural healthcare, but it isn't just the patients that are on Medicaid and Medicare that get screwed over when you have provider losses. If a doctor, if a health center, if a dialysis clinic has 70 to 80% of their patients use Medicaid, and that then Medicaid has a cut, and through all of these various means that they're using to attack it, or they can't get grant funding, and it closes, then there is no access to that, even for people with commercial insurance. Musk was spending quite a lot of time talking about all the various things that he was going to do for healthcare. But one of the funnier things was that he was saying he was going to like consolidate all of these federal payment systems. So like I mentioned, like Ryan White, Black Lung, Medicaid, Medicare, everything was going to be funneled into one payment system. And then he was like, and then next, what we're going to do is we are going to do the same for employer provided insurance. We're going to like, instead of having all of these tax breaks for companies to pay for insurance, we're going to like funnel it all into one funder pool. And that's what's going to provide the funding for it. And it was kind of funny because a lot of progressives were like, wait, what you're proposing is universal coverage. Like, you are literally proposing that everything funnels through the government and we don't do it in all of these segmented ways. And even progressive lawmakers were like, wait, isn't that Medicare for all? Aren't you proposing that? That sounds great. So yeah. Sounds like it's only punitive. People suck. So I have spent a while trying to find like positive parts of the big, beautiful bill that will have better outcomes for people. I mentioned a couple of the cool things that they did with the student loan funding last week where I was talking specifically about like how cool it was that they were now making it possible to use Pell Grants for workforce training that is like shorter. Theoretically, that could open up access to a lot of workforce development for low income people. That all sounds great. What I will say is I have not found a silver lining thus far in the world of what they are doing to healthcare in this bill. The one silver lining that I could say is that, like, for a while, DOGE seemed like it was proposing universal coverage, which I would love to see in the United States. I don't know under our current systems how we could ever implement universal coverage as it exists in other developed countries with the state of healthcare as it is right now. Like, there is a possibility, like I have said over and over and over again, like the only way that we can truly fix the systemic issues within American healthcare would be to like burn it all down and start over from scratch. But that is messy and complicated and very, very hard to do when it comes to people's health, right? Like, but we have a very segmented, very broken system, and it's broken at many, many levels. And this is my attempt at optimism here. The only thing I could say is things could get so bad and they could do such a number on access to healthcare with these provisions that it's the beginning of the burning it all down that maybe we need to restore a better system. I do think that we need the economy to be strong in order for that to even be potentially possible. Or I think if you look historically, we've seen countries do it when they are rebuilding, when they are willing to take on significant amounts of debt. So like the National Health Service in the United Kingdom, which is having its own serious issues right now, but like the National Health Service in the United Kingdom was born out of a post-war boom and rebuilding where they were taking out like massive amounts of debt in order to rebuild. And so I could like see that potentially like as things get maybe worse and we have more of an economic decline brought on by various economic policies, which is not a foregone conclusion. It's a possibility. Like there is a lot of macroeconomics decisions being made right now that do not look good for the United States. But there is potential. Like the person in charge is a business person. And if we continue to have the markets and businesses think that he's going to make decisions that will be good for the economy in the long term, then there's a possibility that we continue to sustain some level of growth longer than maybe realistically we are producing. That's unreasonably hopeful, I think, in the current context. But maybe I could see potential, like if we slide into economic decline and we need to leverage ourselves, we could maybe then use that as potential. I mean, healthcare is one of the largest industries in the United States, and we spend so much money on it that there is so much, like if you were going to talk about creating efficiencies in the American economy, and in particularly in the government sector of the American economy, there is great potential for streamlining in healthcare. The problem is the way that they're approaching it, in my opinion, is not broad-based enough to have results that will result in better care for people. Instead, it's just resulting in chaos, and it disproportionately hurts rural communities, and it way disproportionately hurts working class people. The requiring working service for Medicare is punitive. Well, it's for Medicaid. I might have said it wrong. It's possible I might have said it wrong, but it is confusing because the names are so similar. Okay. So this is for Medicaid. And is it punitive? I think it's based on a good idea, which is the idea that like the government shouldn't necessarily there are a lot of people who believe the idea that like you shouldn't be subsidizing people that are not willing to um help themselves. I don't necessarily agree with that philosophy, but there are a lot of Americans like that is like a very common belief in America. So I can absolutely see how you sell this to people with the idea of like, well, we're just kicking off those lazy people who aren't going to work. But in essence, this does none of that, right? Like all it does is punish the people that need healthcare. I mean, in the end, that's what it does, is punish people that need healthcare. Um, that the good news is probably its children will be less hurt by this. I I mean, I think we can all agree that we want children to have healthcare. I think that's like a basic, like, as a human, I want children to have healthcare. And these cuts in particular will not, these like implementation of work requirements will not hurt children directly, mostly. There are some cases where there's going to be kids on Medicaid expansion under their parents, or kids that are, yes, kids under Medicaid expansion for their parents, and their parents would lose it, and then they might lose it. I'd have to really parse that out. Generally, this isn't going to affect poor children very much. The downside of like this whole situation is, like I mentioned, it's not about where the cuts are targeted. It's about for rural areas in particular, it's about this whole system, right? Like if you are a rich person in Baker City that has a kid, you still don't have an OBGYN that you can visit there. You have to travel 40 plus miles in order to get access to any care at all. And so if you are expecting, and it is at time of year when there's inclement weather, so either like the peak of summer during wildfire season, like the I-84 was just closed like 2 weeks ago because of wildfires. And there's even more wildfires out there right now. Or like in the winter when the passes are regularly like icy and closed. We also, compounding this is that we just laid off, well, we'll see, but they just announced close to 500 layoffs at our Oregon Department of Transportation. And in particular, a lot of those are snowplow drivers on that one highway in and out of Baker City. So what do you do if you're a poor person? You just hope that an ER doctor has the training and is able to deliver your baby if something goes wrong. Maybe you hope to like have a community midwife that can help you. That's your best hope, right? And if you're rich, you travel the 40 miles and you might stay and wait like as long as you can afford to, which is true. Like people do that in Baker City. They go wait in Boise or they go wait in LeGrand, like close to their due date because they don't, especially if they have a medically complex pregnancy, which is like not a practical, that's not practical or even affordable for a middle class person, right? So, it's kind of wild. Okay. How are y'all doing? Are we depressed? Tell me something that you're looking forward to this week. How about that? Do we have any uplifting comments about rural healthcare? I think one of the coolest parts about rural healthcare is a doctor is most likely to know their like most of their patient panel. People really do know like the individual needs of patients, and in many ways the bedside manner of rural healthcare is often much better than you get access to in urban areas. Winter says Ajax just got a clean bill of health from the vet. Oh, yay! That's lovely. That's our healthcare related thing. trying to think of what I'm looking forward to this week. What am I looking forward to this week? I did start researching a totally new planner. So there's another small planner company that is making a planner, and I'm strongly considering getting it, but I think it's too much planner for me. And we should mark this in the book. I should probably not get the Faded Chronicle planner. I have been really liking my Kinbor, and the Kinbor's pretty great. This little guy has been pretty awesome, and I should probably just keep using it. I have had a bit of a like nightmare scheduling week where I was too overscheduled this past like week, and I didn't even get to sit down and like think about my forthcoming week. I was just wiped out because I had like a union meeting on Friday. I had a bunch of doctor's stuff to do on Friday. And then I had skating practice. Then I had a union meeting. I was supposed to go to a celebration of life thing, and I couldn't make it because I had to go to bed. Then I had to get up and try to raise $5 million because all of our funding got cut on Friday by Congress. It's actually 9% of our funding. It's not all of our funding. We are not the stations that are in the really bad shape. It's like the tribal and rural stations that are in really bad shape. But anyway, I had to go raise that money. Then I had to go be Lord Farquaad in Shrek on Ice. Then I had to go to the gym because I'm doing this 30-day challenge again. Then I had to go to bed. Then I'd get up, raise money again the next morning. Then I had to go march in Pride for work. And then I also had to then go to yoga class. And I was just like done by Sunday night. And I was actually like very, very low energy on Monday morning. And I was like, is this because I overextended myself this weekend? Anyway, because I was very low energy on Monday morning, I didn't do like the same amount of normal prep for the week. And one of those things was like, I didn't sit down with my schedule. And I am already like extremely confused by my schedule. I'm honestly moving to the Netherlands in part due to increasing issues with healthcare. I heard Aetna is leaving the Medicare market and leaves United or Kaiser here. Yeah, I have Kaiser, not through Medicare, but I had it through OHP, which is our Medicaid, and now I have it through an employer plan. They're like really big in the market here. And I love Kaiser, except when I hate it. It's generally like, it's the best of American health insurance that I have had, but it has problems that are very specific to Kaiser in a way that, you know, don't exist in plans that have like more competitiveness in it. I do think Kaiser is like very similar to what it would be like if America got single payer healthcare, like universal coverage. I think it would look a lot like how Kaiser HMO looks in the US. I will say the Netherlands has a very interesting healthcare system. The Netherlands is not the best of developed countries. Like, they still unfortunately have insurance. They still have a lot of like the fee for service models. They do have universal coverage, but you have to like buy a plan on a competitive market. And one of the nice upsides of it is that the plans have to cover, like, it's like a much more beefed up version of ACA compliant plans where like pretty much they don't get to compete on anything except like the shiny marketing because they're pretty standardized across it. But you still have to deal with like reimbursement and arguing with them and everything, which I think might be even more frustrating if you don't speak Dutch. I don't know if you speak Dutch, but the Netherlands I think is worse than Germany's, and Germany's was not amazing. The other thing to like look at with the Netherlands is if you're not a citizen, I believe, I would need correction, but I believe it's like Germany where it can be hard to buy in to an insurance plan if you are over a certain age. So like if you're over, I think it was like in Germany it was 25, but I couldn't obtain like the standard insurance through the 3 plans because I was a foreigner on a visa. I was on a proper visa. But I was a foreigner on a visa and I was over 25. And so I did not have access to buying like the three main plans. And I had to get it from the private market. And the private market, there essentially it didn't cover anything. So it like didn't cover pre-existing conditions or anything like that. My biggest issue is with Kaiser's physical therapy. They let you see a PT once a month at most. Physical therapy is one of the things that I think Kaiser is like universally the worst at. They used to be really bad at mental health care too, but they got sued for that in Oregon because we have like a mental health parity healthcare law here, and they got sued, and they like way expanded access to mental health care, and you can essentially go outside of Kaiser and bill Kaiser for it now, and because they got sued. I am waiting for the PT lawsuit at Kaiser because I know quite a few people that have I know people in the that have had Kaiser and have needed physical therapy, and Kaiser has told them it's an 8-month wait, and so they've just gone to the private market for it. It's crazy. Also, like with PT with Kaiser, like I've had a PT and OT referral, and there's just like no appointments available at all. And I also know physical therapists who for other providers that they have people who's been screwed up by Kaiser's PT. Also, like my PT appointments with them are like 20 minutes when I've had them before, and they'll be like 55 with other PT and OT providers. So anyway. KWAT comedy. Okay, I have a follow-up question. What do you not do? Because I feel like you drop lore every time. Every time you're like, actually. But more important is, how is your family doing? I feel like that's the most important question to know. But also, you do so many things. When do you sleep? Yeah, mine is always limited by year. And also I was in this like cool position for a while where my OT and my PT were counting towards separate amounts when I was on Providence. But yes. $100 a month for insurance through the state. But the question is, if you are not, okay, the problem is sometimes you do not qualify for the insurance through the state. So that's just the thing to know about. You really just need to talk to like people that are going to be in the same visa situation as you, and like ideally live in the same place. The Netherlands has every country has flaws in its healthcare system. It's definitely better than the United States. I am not going to make any argument against that, but they love to screw over people that are not citizens like way more, and that is just generally true with like all of the European countries. $100 for visa holders or $70 for citizens. Oh, that's pretty cool. And there's no like exclusion for it. My mom is on the mend, just spent 3 weeks FMLA helping with meals and doctor's appointments. The meds were crazy. I am so happy your mother is on the mend. Yes, I agree. I thought I did a lot until I heard about you, KWAT Comedy, and I'm like, do you sleep is my real question. I'm so glad you had access to FMLA though, and were able to help with that and in a potential to do that. Yes, I would be also very curious if you will get the same kind of access to PT in the Netherlands. I think it would be worth checking into, because I think it's very likely that it would be true. I mean, you would need to know about it, but like, I think it's very likely you will, because of the way that they do billing in Amsterdam. So, or in the Netherlands. The people I know that have had the billing in it. Most of what I know about the Netherlands healthcare system either comes from The Economist or a book by Dr. Ezekiel Manuel, who is one of the architects of Obamacare in the United States. But he wrote a book in 2020, I think, maybe 2021, called Which Country Has the World's Best Healthcare? And it contrasted 12 different countries, like healthcare systems. Spoiler, they all suck in different ways. They all have their own problems, but the US is definitely not the best one. I think we're the worst on almost all metrics except innovation. Um, I hate the wait, but I love the fact that when my doctor sees me, he takes time and knows my family and is part of my community. I think that is one of the things that I dislike about Kaiser the most. Like, in addition to being like a huge urban healthcare system, the patient loads are outrageous for the doctors. So, like, I was just, you just get assigned to a doctor in Kaiser, and like, you can ask to switch if you don't like the doctor you get assigned to, blah, blah, blah. But I got assigned to a GP and like didn't see the GP for like years. But they still had to like sign off on my referrals to my other doctors. But like, I had to see a rheumatologist within like 3 weeks because I had to get approval for my medication. I only have when I switch insurance plans, which I have unfortunately done a bazillion times in my life, I have only at most a 30-day window to get my meds because I never get more than 28 days of my medication from any insurance. So I'm like up against a clock, and it can be really challenging because I always have to like get the pre-auth, and the pre-auth is like, sometimes it has to come from a rheumatologist. And then with Kaiser, my outside rheumatologist couldn't send the referral into Kaiser. So yeah. K-Walk Comedy, I am going to say, I was considering auditioning for a play, but I decided I better not, as I may have to go back to Jersey in September if she has another procedure for her other failing valve. I think it's probably a good idea to not do another play. That is scary, though. I hope it's just as safe this time, like that she heals up well if she has to do another procedure. But yeah, it seems like you have a lot on your plate. Maybe just focus on like the last year of your career. Oh. I'll keep you all informed. My friend just moved there yesterday, so we can find out more from him. I've been getting all of our information from his husband who lives there. Also on the forums, we also have another person who just moved there who you probably know this. But who just moved there how many weeks ago? Like 6 weeks ago? 6 weeks ago, but Oro moved there and moved to The Hague. So it's worth kind of chatting about that. I think the housing is the biggest problem. B says, I'm going to read this book. I really recommend a lot of Dr. Ezekiel Emanuel's work. He's written quite a few books. He is he's an oncologist, but he also writes a lot about medical ethics. And he was quite famous for a long time of like, after a certain age, I don't want my life extended beyond a certain amount. And he does a lot of thinking about like medical ethics. He's very fascinating. I interviewed him for a piece I did with The Indicator for Planet Money on healthcare churn a little while ago. He's very nice and very generous with his time. And he's Rahm Emanuel's brother. David says, David, for once, is not complaining about his job. I have decent insurance, if nothing else. I feel like all insurance, I also feel like if you don't have a lot of medical needs, you're like, a lot of people are happy with their insurance until something goes wrong. I feel like how it feels universally to me in the United States. I don't know. Kaiser, it has its flaws. And I would say PT is one of their big flaws. Sometimes so their travel clinic is another example of like, it's just like Kaiser, one of their selling points is because they're an HMO, like everything is like integrated. Everything's like in almost everything I ever need to do in Kaiser is like all in one building. So it's like super convenient. And I can like go pop and get labs, and then I can just walk upstairs and see a doctor, and I can like schedule everything in one day. The downside about Kaiser is that like weird departments are just not integrated with the rest of the systems. So like the travel clinics, like, phones weren't working for like 6 months. I think I mentioned this before because before I went to Asia, because I had reached out like 8 months in advance of my trip to Southeast Asia because I knew there were certain vaccinations they were going to require me to get, and some of those series are like long. So I'd reached out to the travel clinic, and then they like called me back, and then we never connected for a bunch of months. And it turned out like every time I left them a voicemail, it was just disappearing into the ether. And then when I finally did get a hold of someone there and I got all the vaccine recommendations, their vaccine recommendations don't get put into the normal system. So it's like a little note in a random file that someone at the lab has to check. So as someone who like goes to the lab quite regularly to like get blood draws or all the other various things that I need to do in the lab, they then never saw that I needed like follow-up rounds of certain vaccinations and stuff like that. So it's Oxford, which is owned by United Healthcare. Well, I don't know if I would describe that as decent insurance. David says, by the way, I think I convinced someone to buy your book. Well, that's great. I've shipped out a lot of books this week, so it's possible if someone already ordered it, they already go. I'm sad that I didn't know that they were a friend of yours, if that's true. That's a good reminder that I need to ship out a book. When our power went out earlier today, I was like, well, I can't use a printer now, so I can't ship a book. So I need to package those up so that I can ship them out in the morning, because I went to the post office, but I couldn't mail them because I did not have the printer. All right, y'all. Tell me what you're looking forward to this week. Ajax is doing better. K-Walk Comedy's mom is doing better. That's very exciting. Who else is doing well? What else? What other good things are we having happen this week? I am possibly going to use this cute little book that I got for my birthday. It's so cute. Look how tiny it is. It's a Nunca, and it has page numbers and a dot grid, and I got it for my birthday 2 weeks ago, and I have been in analysis paralysis about it because it's so nice, and I want to come up with the best possible way to use it. So I've been trying to figure out what exactly that is. Fuzz Bubble said, this is a reminder I should check with my chaotic friend who bought a book and then didn't check her mailbox. So I'm going to put this out there because I feel like this friend would be a great target market for this. So I think I've mentioned before that I was supposed to be writing a book, co-writing a book about American health insurance. It got shelved for the time being because of the publisher was like, we don't know what's happening with healthcare in the United States. So like, not the time for the book. So I met with my agent and we came up with another idea for a book, which is essentially a version of A Cat's Guide to Money. Like it's a finance book, but it is targeted at people with ADHD. But we're not going to call it like the money guide for ADHD because one, that's like clinicalizing it. I want to find a way, like a title and like a way of framing it that is specifically makes people feel like they would want to pick up the book and get tips and tools for dealing with money if you struggle with like impulse issues and you get really stressed out by it. I've been trying to figure out like what it is. I feel like the book You Are a Badass at Making Money, which just like said that in really bold on the title, did an excellent job of like topping a bunch of bestseller lists and everything because it, I think, was very attractive to people that have like physically attractive and felt like it solved a problem in the title. The person who wrote it had an existing platform, but I think it felt like it solved a problem to people that struggle with those kind of exact issues. So I actually haven't read that book, partially because I'm worried that I'm going to like accidentally steal stuff from it. I I've heard like mixed reviews from money finance people. Usually I like to read comparison books, but like that one felt like it was targeting such a similar audience to A Cat's Guide to Money. I was like afraid to read it before I redid the second edition of the book or third edition of the book. But I want to figure out like a title, something that like captures there is. And anyway, I wanted to say my agent also thinks there's a demand for this. This book, The Anti-Planner, which I've done like a light review on here. I should do like an edited video review on this. There we go. If your bingo card had Lillian suggest doing an edited video that she's never going to do, check it off. This book was like excellently designed. I don't know why I'm holding this up when I have an overhead camera for this particular purpose. I thought it was like excellently designed because it had a lot of cool tactics where it would like give you ideas about like how to get started, and you could use it in a disorganized sort of way. And I say that with love. Like there was no requirement that you read it front to back. You wouldn't feel bad about just like picking it up and going to a random page. And it actually is very helpful for like, if you are someone like me that ends up being affected by procrastination and has Googled or YouTubed how to make yourself do something. This is it in book format, which in fact is much better than going into the comments of yet another YouTube video where everybody is like, who else here is trying to finish an essay or work on a deadline at this time of day? Anyway, I would love to make something similar to this. Maybe not wire. This is a very expensive book, like physically to make. Also, the author of this, who did, I believe, self-published it, immediately had like ripoffs of it being sold. And one of the advantages is that I would only probably do this if I went with a mainstream publisher, and a mainstream publisher would be more aggressive at sort of like dealing with those things. But I think that this could be very useful. Like you could like open it and it would be like having a productive conversation about money with people in your life, having a productive, anyway, I like choose your own adventure for getting things organized. Do the task that you've been putting off for 6 months to 2 years. So yeah. I think the anti-planner could help with my leaning to instant gratification rather than longer plans? I think it could. It has a lot of, so the way that it is structured is if you are struggling with like, it's not a planner, just to be clear. It is not a planner. It is a anti-procrastination book. So like you identify what emotion you're feeling. Are you feeling stuck? Are you feeling overwhelmed? Are you feeling unmotivated? Are you feeling disorganized? Are you feeling discouraged? And then there's tabs. And then it'll ask how you're feeling. So like, let's say you're feeling disorganized here. This one is, I'm feeling disorganized. Then there's subtasks. So it'll be like, you're feeling messy. My space is full of clutter. I have moldy, rotten food in the fridge. Or difficulty prioritizing. I avoid doing important things first. I have a hard time planning things out. Then it will give you an activity for those. So if you're like, yeah, so this is a great example of like the kind of activities in this. This is clean by numbers. So you would fill in the color key, like the room that you want to clean, and then you get a like color this in. So it has just like a lot of different types of activities in here. And difficulty prioritizing would be probably a great example of like something if you're dealing with like the instant gratification issue, then this is like one of the things that you could do on that. I don't know. I found this valuable. I don't use it very often, but I will break it out when I'm really struggling with something. I think we've been talking about how, I've brought it up several times about how I've really been struggling with prioritizing edited YouTube videos and just generally doing things that aren't live streams on YouTube. And one of the things that I have been kind of using that for is like, why can't I prioritize this? Because I'm not someone who I'm decently good at like discipline, and I'm decently good at working towards longer projects. I'm even pretty good at like identifying a long-term plan and breaking it into smaller, like manageable chunks. And I can do all of that for YouTube, but then I can't actually find myself prioritizing the time. And one of the things that I have ended up identifying, which some of the exercises in here have helped me with, is just that it's just too similar to my day job. So like it is very hard to sit down and on my day off want to edit, which is something I do 10 plus hours a week at work, to want to do voiceovers, which is something I do like 12 plus hours a week at work, or research and script, which is what I do the rest of the time at work. And so like I produce multimedia journalism at my job. And so it is extremely hard to want to make multimedia products on my days off, even if they're about totally different topics, and in many ways would be like satisfying to do things that I don't have the ability to do at work. So yeah, I have really struggled with that, and some of my ability to figure out why I've been stuck on that has been true. Because like, I don't think I'm someone who is, I generally, I think I've talked about this before, but I generally have like, I'm pretty good at setting goals for myself and identifying what I need. And I've worked a lot on self-trust, on the idea that like, I believe myself when I say I'm going to do X, Y, and Z. But it's been very hard to prioritize making YouTube videos on top of my job. But I very easily prioritize going and working out for an hour every day, like participating in skating shows that require 5 to 10 hours of practice a week for like 8 weeks. I completed like a 100-day yoga challenge last week. I have a pretty regimented like schedule that I stick to for a lot of other things. But then I cannot find time for YouTube. And it isn't that there isn't pockets of time. And I think it has a lot to do with the overwhelm and the similarity, but also needing that variety in the way that I structure my week. I've seen the creator talk about this on TikTok and it looked promising, but I hadn't purchased it yet. Yeah, I saw it for quite a long time before I was like, yeah, I'm going to try it out. And part of how I justified it to myself was that I could review it on YouTube. So I actually need to break this out because I have an invoice that I need to send. And it's like an $1,100 invoice, so I should absolutely send it because it's worth a chunk of change. But I have been putting off sending it because I don't know who I need to address the invoice to, because it's to NPR, and NPR just like changed their freelancer payment system. And because there is an unknown, I cannot sit down and like figure out who I need to ask to then find out how I get into the new payment system and invoice. It's so dumb because it's like $1,100. So I absolutely this is not an amount. And also it was a ton of work, the thing that I did. And so I cannot put off doing that invoice, but I've needed to do it for like a month, and it's going to take me like 10 minutes. So I had an ex who asked the mail carrier how long it would be, how long they could go without checking their mail before annoying off the mail carrier. And the mail carrier was like, well, you've got a very deep mailbox, so it'll probably take like 6 weeks to build up mail. And I was just like, that was bananas to me, that you would go out of the way to ask how long you could put off not checking your mail rather than just check your mail. I don't know. And it's not like the mailbox, it was like, at their entrance to their building. The contractor promised his guys will come help move my desk and bookcases up 2 flights of stairs because I can't do that alone. I got some furniture up alone, but it hurt. I hear you. If it makes you feel better, our professional appliance sales center, they came to install the appliances and they saw our stairs and our fridge and went, there's no way we can move that up. We're going to come back with more guys and a better harness. And then they came back with more guys and a better harness. And they still said, actually, we can't get it up the stairs. So I'm just saying professionals who do this all the time still misjudged the amount. Also, please, but hauling the books up, I feel like is like way easier because the books are like, you can make them marginal sizes. But the problem with the bookcases is that they are just awkwardly sized. So even if they don't weigh a lot, it's like, you know, the maneuvering. And if they are heavy, then they do weigh a lot. Money for chaos gremlins. I don't know if that would fly with the publishers, but I like the direction you're going with that. Same thing happened with the new fridge. 3 attempts. Oh no. I'm so sorry. I like Rex's very easy one, which is got my Nintendo Switch 2 today. Looking forward to playing. I'm very excited for you. I hope you have a lot of fun. I don't know anything about Switch except that I know that Animal Crossing is on it. That is the only game that I could confidently... No! Mario Kart's on it too. That's the only other one I know is on it. First time they said no way. Second time they sent 4 Georgians who just refused. Third time no complaints. Interesting. Well, I guess this is exactly what I would say about that. All right, y'all, I don't have the union meeting, which you probably understood because we went over 30 minutes, but I should probably pack my lunch for tomorrow and get ready for work tomorrow. I hope everybody has a lovely week and enjoys their Nintendo Switch, possibly getting their new desk up the stairs. Hopefully everybody's health continues to improve, both Ajax and K-Walk Comedy's mom. I hope that, David, you enjoy not being in Bulgaria. And I hope everybody has a lovely week. Stay safe, stay hydrated, pet a cat if they're available. And I will see you all next week. Bye.